Cancer causes 8.4 million deaths every year in the whole world.
When you talk of cancer in this country, the biggest challenge we're having is cervical and breast cancer amongst women, and esophageal and colon cancer and prostate cancer amongst the men.
Cancer is very expensive to treat. Cancer, a lot of cancer patients, actually when they're told they have cancer, they just go home to die.
In this country, people think palliative care is for the dying. It's actually from the time you make a diagnosis of an incurable disease.
The member states that make up the World Health Organization, and World Health Organization in itself is just a secretariat to the member states. So what the member states come up with during the World Health Assembly is what WHO enforces and advises the countries to take up what they have agreed at the World Health Assembly. At the local level, we have advised the country to prioritize NCDs, including cancers, such that we look at the prevention and control.
In May 2014, at the World Health Assembly, there was a resolution passed by WHO on palliative care. And this is the first time such a resolution has been passed on palliative care. And it talks about integrating palliative care services into the healthcare system of a country, a member country.
At the global level, cancer is a big threat. Cancer causes 8.4 million deaths every year in the whole world, and 14 million new cases every year. And unfortunately, 70 to 80% of these cases occur in the low and middle income countries, where Kenya is one of them. What WHO does is advises the country. At the local level, we have advised the country to prioritize NCDs, including cancers, such that we look at the prevention and control.
Cancer registration, or the activity that helps us to capture the numbers of cancer, has not been very well developed in this country, and we are working on this. We only have a Nairobi cancer registry that covers cancers registered around the environs of the metropolis of Nairobi, and we also have a cancer registry in Eldoret, and we also have a small hospital-based cancer registries across like Tenwek Hospital. Other former provincial hospitals also have a small little cancer registries. So what we see is just a tip of the iceberg. Cancer has increased, but the sad story is that the biggest chunk of that increase is in developing countries. So that you might find cancer is increasing in the Western world, but not in the same rate as it is increasing here. Of course, there are things that have fueled this. First and foremost is our lifestyles. Two, we have infections that fuel cancers, the HIV, human papilloma virus, some infections of the liver, and other exposures like for asbestos and aflatoxins that come from poor storage of maize.
I was diagnosed with breast cancer in June. At that time, I was 5.5 months pregnant with my second child. Of course, I was in denial. It was very traumatizing. My team of doctors wanted I have the baby taken out early, put the baby in the incubator so they can start treatment for my cancer. But as a family, we decided against that. So I delivered my baby in October of 2005, and then that was in October 13th, and then October 31st, I left her at home at 2 weeks so I can start my cancer journey. I had my mastectomy, which is total removal of the breast, because they couldn't save my breast at all because the tumor was really big. And then after the surgery, 3 weeks later, I started my chemotherapy. I did 6 months of it. Then after the chemotherapy, I did 30 rounds of radiotherapy. Then after I finished all that, I started taking a hormonal drug, and I'm currently still on the hormonal drug.
I normally stay at Kibera slums. I am a father and married. It was 2002 where it was discovered that I have cancer. So me myself, it was started on 1998. It is when I started suffering, but without knowing that it is cancer. Well, when it was discovered by 2000 by Nairobi Hospice, I have been with them, they have been with me up to now I'm speaking. So it was a day on 2000 whereby I was lying in my house, and we was with the community workers who was working there at Kibera, who came to visit me. So they brought another doctor from the community clinic who came to see me, and she was the one who discovered that what I'm suffering is cancer. I was in deeper pain whereby I could not manage in this antibiotics drugs. So they used the higher tablets to make me not to be in pain.
50 to 60% of cancers in this country present late, in a stage we call stage 4, where the disease is too advanced and it's difficult to treat, and even if it was treated, the outcome is very poor. When you compare HIV and cancer, HIV has numerous partners, numerous trainings, numerous opportunities for awareness, media partners who put in a lot of coin for HIV awareness. Cancer, probably pharmaceuticals or the government doing its traditional role. But more so, let me say, we are trying to use the community strategy. The national government in 2010, around 2010, revamped the community strategy to try and take information down to the community health volunteers who have direct contact with the people.
At this time, we also urge the government to make sure that the health systems are ready, because if we encourage people to go for screening and they are found to have the conditions and the health systems are not ready, then again we are creating a problem. If we can do prevention first, early screening, then at the end of the day we can manage cancers, because about 30 to 40% of cancers can be prevented, and again about 30% of cancers can be treatable.
For those few who can afford, the queue in Kenyatta, it's ridiculous. I mean, to get into the radiotherapy machine, if you are lucky, it's 6 months from now. If you are lucky, the cancer cells are not waiting for you.
Cancer does not just end with treatment or stop with the lack of that treatment. And so palliation is a thing that the ministry has really put a lot of effort on. And we have palliation centers that are both standalone and in government hospitals that have been done very kindly with the assistance of a partner called KEFCA.
Almost 80% of cancer patients suffer moderate to severe pain treated. They will need to have their family counseled. They'll need to have a lot of psychosocial support during their illness, spiritual, financial, emotional. So palliative care focuses on giving this support to patients. Most patients will be a bit reluctant when you tell them about these services because they think you're abandoning them. But once they get to know what you're doing for them, they actually are very willing to come and receive the services.
I've been with the Nairobi Hospice for all these 15 years. I can't tell you that I've been to the other hospital, no. They're the one who takes care of me.
The first step is to counsel the patient to make them know they have a life-limiting illness or life-threatening illness, that they're going to live with it. And it doesn't mean it's a death sentence right from the time diagnosis is made. Besides that, you also focus now on relief of symptoms. Now that cure is not possible, now we focus on caring for them. Sometimes back we realized that most of the patients would default their appointment to come to the hospice, and the main reason for that was because they could not just get the transport, the fare to come to the hospice. So the hospice does an outreach clinic in one of the slums in Nairobi.
I have seen the number of patients coming to see us increasing.
We have inaugurated the Board of Trustees of the National Cancer Institute, and one of the mandates of this board is to advise the Cabinet Secretary and the Ministry of Health as a whole on priorities, on innovative ways of both prevention and care of cancer patients.
We have about 18 hospices. We have about 40 government hospitals that have put palliative care in their services. We have also mission hospitals, that about 8 or 10 of them that support patients. But we don't have enough numbers of patients coming to these services.
It might not be possible to have in every facility walk-in cancer treatment, but we'll have regional centers where a patient doesn't have to travel to Nairobi from Kitale. They can actually get their screening, their treatment and follow-up, including palliative care, right where they are. Kenyans should take responsibility of their own health. There is so much that the government can do, but there is a part of it that is a self-initiative.
If you have cancer, you should not let the disease put you down and suffer. You can actually get these services that can support you to have a better quality of life. And for healthcare professionals, please let's encourage our patients, let's refer our patients appropriately. Let's not wait until the patient is dying and refer them for these services.
A lot of us, we go to the hospital when we feel sick. And by the time you are feeling sick, maybe it's a bit too late.
My hope is that very soon we shall have cancer centers in all the counties, such that at the end of the day, when you are told that you have a cancer, you just quickly go to a nearby health facility in your county where you are taken care of.